Yes, welcome back. OK, it's been unrelenting misery so far on this show, but I'm going to try and give you a little bit of a good news story. The drug lecanemab has been heralded as a breakthrough, a massive breakthrough in the fight against Alzheimer's by attacking the build-up of protein in the brain of sufferers of the disease. So, the drug was found to have reduced the rate of cognitive decline by 27% in a study of 1,795 volunteers that lasted 18 months. It's hoped that the drug can provide some much-needed hope to the 500,000 people in Britain with the disease. And it really is an absolutely shocking, debilitating, horrendous look. We all know, don't we? One of the worst, if not the worst, disease you can possibly get. Joining me now is Lucy Johnson, Health and Social Affairs Editor for the Sunday Express, friend of the channel. Now, it's great to talk to you about something other than the striking workforce or issues with the coronavirus vaccine or goodness knows what else, or kids failing mental health. This actually is conceivably a good news story, is it not? Lift the spirits of the nation.
It is if you look at it with your heart and you think, well, actually, it's brilliant news. It's the first time we've seen decades of depressing failures in Alzheimer's treatment and drugs, and we've never seen anything that actually slows progression of the disease, and it's the first time this has happened. So many experts that I've spoken to today say, yeah, it's the beginning of the end. It's a breakthrough, and it's very exciting. There is a sort of caveat to that, well, it's not a cure. And also there are concerns from the Alzheimer's Society that the NHS doesn't have the capacity really to treat all those eligible patients. Probably only 1 to 2% of them.
OK, just fill me in. Just fill me in on this. So presumably someone maybe who's got a family history of Alzheimer's could get it, or someone who's maybe showing the early onset signs of it. Conceivably, how does it work then? Is it in pill form? What is it?
It's an infusion, and it's taken every 2 weeks. So you need the infrastructure and the staff to do that. It only has been shown to work in people with early onset Alzheimer's. Right. And we know Alzheimer's is the biggest cause of dementia, and 1 in 3 people born today will get a form of dementia. So it's a huge problem for the country and a huge drain. I think it cost £25 billion in caring costs in the country. So it is one of our biggest, disease burdens.
Forgive me for potentially, I don't know, lowering the tone, as it were, but you just said there that 1 in 3 people born today will end up with some form of dementia. Here we have potentially a new drug that may, well, whilst it's not a cure, could slow down that process somewhat, and we are hearing that the NHS might not have the capacity in order to administer that. One would have thought that this would become a priority.
Well, to be fair, at the moment, it's not been approved, so that needs to be properly looked at. There have been sort of side effects noticed, and because you wouldn't necessarily pick up side effects in a sample of 1,800 over a larger number, there may be more people. I know there was a couple of strokes on the trial, not necessarily statistically significant, but over a bigger sample. So we're not there yet, but the significance of this is that it shows potential. It's the first time we've seen the potential. And yes, you're absolutely right. If there is a drug out there that can help improve the quality of lives and the lives of sufferers and their carers, we should be ready for a new era of medicines like this.
Yeah, well, indeed. Well, fingers crossed. And look, anything that can help at all, I think, is a massive breakthrough. And I do suspect, whilst I do not want to obviously talk on behalf of anyone who has suffered or had loved ones who've suffered as a result of Alzheimer's or dementia, one would have thought that given the choice between potentially a couple of nasty side effects or almost definitely having the Alzheimer's and dementia, I suspect, I know which way that people might head in that direction. Now, just can I get you very quickly on something that's been doing the rounds, and we've had loads of emails in about this. I'm keen to get your views, and it is about the strikes that we've been seeing. I'll get you to just comment, if it's OK, on some of the potential nurses' strikes. I was absolutely sickened when I learned that Alderhay Children's Hospital and Great Ormond Street Children's Hospital might be, well, will be, part of the strikes there. It just, in your view, because I've been getting a lot of spin from doctors here, in your view, will the care of essentially terminally ill children be affected in some way as a result of these strikes, or not?
I think people's lives are potentially at risk. I've spoken to surgeons who say they won't be able to perform vital operations. There's no doubt that these strikes will have an impact. No one can say that they won't. And
Yeah, well, they're trying
it's all
to.
very well. Well, how can one know? How can one actually say this is not going to impact? These things have a knock-on effect.
Right.
They have a knock-on effect on waiting lists. If you need a cataract operation and you're waiting and waiting, it may lead to your death. You may fall down the stairs. I mean, of course, all of it has an impact. And, while we have problems in the NHS and while it's got problems with its function, we know that, there are things that can be done, like weekend working, like improvements in the IT system, like lots of things we've talked about before.
I'm amazed, but I'm sympathetic towards the idea that nurses should have a bit of a pay rise. I get that. 19% madness. No political party supports that at the moment, and rightly so, because it would pave the way for other sectors as well. It will become completely unaffordable. It will be like forcing us to be a bankrupted socialist state by holding a gun to our heads, and no one really, realistically, I think, wants that. And I've been amazed by the vitriol online. I'm capable of having the view that I think nurses deserve a bit of a pay rise, while also saying, do you mind not striking at a hospital full of terminally ill children in the run-up to Christmas? And that apparently makes me a monster. But there we go. Thank you very much for your time. As always, great to have you on the show. A friend of the channel, Lucy Johnson, their Health and Social Affairs Editor for the Sunday Express.